LA Times coronavirus tracker shows there were 31,693 new cases in California yesterday.
Wow.
Hospitals are feeling the pinch, and the Arrowhead Regional Medical Center in Colton is officially out of beds in the ICU.
All 48 of their beds are full. The medical center is now planning to convert a conference room and its cafeteria into patient areas so they can deal with this rise. Joining us live is Dr. Erika Flores Uribe. She's an ER physician at County-USC. Thank you for coming back on the show.
Good morning, Doc. Good to see you again.
Good morning. Thank you so much for having me.
So County-USC has SoCal's largest COVID ward. Can you tell us what it's like on the front lines right now?
It is busy. As you mentioned earlier, the numbers of cases have risen, and that's really what we're seeing in the emergency department in terms of impact of hospitalizations. So we are seeing about 500 new hospitalizations, and the concern is that that will continue to grow. Given the Thanksgiving kind of gatherings that may have happened, we can see up to 700 new hospitalizations very recently, very soon.
Dr. Uribe, we see so many stories and hear so many stories. What conditions are the patients in, and what kind of complications are they experiencing?
So we know that with COVID-19, the main concern is about being able to get enough oxygen or breathing support. So those who are coming into the emergency departments are requiring that help with breathing and with oxygen. We have programs in the hospital to try to get home safely those who can. So even if you may have COVID, if you're doing good in terms of a breathing perspective and you have safe return to the emergency department instructions, we can get you home with safety programs. Those who are requiring more intensive care, like oxygen or machines to help with breathing, are the ones that we're keeping in the hospitals.
So, Dr. Uribe, how is this impacting all of the staff emotionally, just watching so much suffering?
It's been a long 8-9 months. All of us who are in medicine generally want to do this to help others, but it has been a long 8 to 9 months. We see that, especially when we think about holiday seasons when people can gather, it makes me concerned as an emergency doctor about what kind of capacity we're going to have in our emergency rooms and in our hospitals to take care of everyone, not only those who have COVID-19, but we're still seeing our heart attacks, our strokes, the things that we would see even outside of COVID. It's going to be really important that we all do everything that we can. And I would ask that this holiday season, please stay home as much as you can. Please only celebrate with those who you live with to help stop the spread of COVID-19.
Yeah, got to do our part to make sure that everybody is safe around us as well. This week, Walmart and some of the other giants talked about rolling out an at-home test. Tell us about the at-home test collection pilot program that you're working on or that you know of.
Absolutely. So LA County did roll out a pilot program for the holiday season. We think about how to expand access to testing all the time. So the first thing that I would say is, if you have a primary care doctor, call your primary care doctor because they can get you connected to a test. If you do not have a primary care doctor, you can call 211. You can visit our website, covid19.lacounty.gov/testing, to register for a test. Now, this pilot program is a way to get a test sent home to you, and we're really wanting to make sure that this is used immediately for those who can't get to a testing site, for example, that is an easy access, like those who may have disabilities or our elderly population. So there is a way to register on our platform, and you'll be able to get a test sent to you. You'll have to do the test yourself and then send it back immediately.
So, Doctor, you mentioned most hospitals are near capacity after Thanksgiving. So you just mentioned that people should try and stay home. What is the worst case scenario if people don't heed this warning for hospitals?
We are seeing a very large number of patients in the emergency department. And I am concerned that we're not at the place where we're seeing the highest numbers we will see even with the Thanksgiving gatherings. We are doing everything that we can to make space to get more people who are trained to take care of really sick people in the hospital spaces, but everything has its limits. We want to make sure that we're all doing everything that we can so that we have the space, the doctors, the nurses, to take care of those who are coming into the emergency department.
Well, Dr. Uribe, we'll do our best to get your message out and continue to get that word out to the people who are watching. Thank you for coming on again. We hope to see you soon.
Thank you.